I'd like to talk today about the potential connection between migraine headaches and disruptions of bowel flora, specifically H. pylori and SIBO, small intestinal bacterial overgrowth. Well, first of all, people who do my basic programs, Wheat Belly Total Health, Wheat Belly 10-Day Grain Detox, or the Undoctored program, in which we eliminate all wheat and grains and supplement magnesium, many people obtain partial or total relief from their migraine headaches, even if they've had them for years. But not everybody does, and there's a substantial proportion of people who continue to have at least some migraine headaches. And I've come to appreciate just how disruptive migraine headaches can be over some people's lives. They're painful, of course. They can keep you from going to work or school. It can cost you a lot of money in way of prescription drugs, some of which are very expensive and not always very effective. So we're always on the lookout for better strategies to manage migraine headaches. And recall that in my programs, we do not treat conditions. We don't treat migraine headaches. We look for the factors that allow conditions like migraines to emerge. There's a big difference. So one of the things we do, for instance, in our deep dive, our Undoctored Inner Circle, is we go deeper into full restoration of magnesium using magnesium water and some other strategies. We talk about MTHFR variants. Those are genetic variants, such as the C677T variant that allows emergence of migraine headaches. We talk about mitochondrial dysfunction that leads to strategies such as coenzyme Q10 or riboflavin that assist in mitochondrial energy production. But there's also a known connection between migraine headaches and Helicobacter pylori, or H. pylori we say. You likely know that H. pylori is a bacteria that lives in the stomach and increases potential for stomach and duodenal ulcers. But it's proven to be a lot more than that. People who have H. pylori have much more stomach cancer, other forms of gastrointestinal cancers, Parkinsonism, fatty liver, skin rashes, even coronary disease. Many of the same conditions that are associated with small intestinal bacterial overgrowth. We know that people with migraine headaches are more likely to have H. pylori. Observational data tell us that. But even better, there are a couple of treatment trials in which eradication of H. pylori reduced the intensity, frequency, and severity of migraine headaches, suggesting a cause-effect relationship. Well, there's more to the H. pylori story. People who have H. pylori that is untreated for many years often have an initial hyperchlorhydria, high stomach acid, followed by a low stomach acid period, hypochlorhydria, that goes on for years. And that, by the way, is a risk factor for stomach cancer. Now, when you have low stomach acid because of H. pylori that's been present for a long time, or if you've been taking stomach acid suppressing drugs like Acifex, Prilosec, or Protonix, those situations where you have lack of stomach acid is a setup for SIBO, small intestinal bacterial overgrowth. And that's because stomach acid is a barrier to bacteria, whether the bacteria are ascending up from the colon, ileum, etc., or whether they're coming down from the mouth, esophagus, from food and water. So stomach acid is an important barrier to the development of SIBO. If you don't have stomach acid, whether it's from hypochlorhydria, from H. pylori, or from acid-suppressing drugs, it sets you up for SIBO. The potential for SIBO, the risk for SIBO is much higher. Well, about 50% of people who have H. pylori also have SIBO. So think now, I'm just connecting the dots. If people with migraine headaches are more likely to have H. pylori, and H. pylori is often associated with SIBO, doesn't it seem to follow that a lot of people with migraine headaches likely also have SIBO? What's not clear is whether SIBO has a cause-effect relationship with migraine headaches. Does it make it worse? But remember that correction of SIBO in and of itself is a good thing, because if you don't correct SIBO, you're setting yourself up for autoimmune diseases, diverticular disease, irritable bowel syndrome symptoms, fibromyalgia, colon cancer, metabolic disruptions like diabetes and obesity. So identifying and managing or eradicating your SIBO is important. But one of the connections I'm proposing is identifying SIBO, then managing it. Could that be part of the solution to better management of migraine headaches? We need better evidence. But I think the sequence of logic connecting migraine headaches and SIBO is so compelling that it's worth looking into and maybe taking action on.